The holiday season is upon us, but so are winter illnesses. Local 3's Brianna McLean spoke with a pediatric doctor about what to know about these illnesses and how to keep you and your family healthy during this time of year. Brianna?
Good evening, Rebecca. With kids back in school and colder weather here, getting sick is almost inevitable. The three main illnesses going around are RSV, flu, and COVID-19. According to the Associated Press, RSV and flu seasons have started earlier this year than in previous years. Dr. Isaac Smith with UP Health System explains why we may be seeing an early spike.
RSV used to be more of a winter virus, and it still is. But last year and the year before, and I suppose this year, the shift is we're seeing in RSV is that it is occurring a little bit earlier, late summer, early fall, and then through the mid fall here this year as well. And I think that mostly has to do with changes in our behavior and also our immunity to RSV. There's a whole cohort of children, or a couple of cohorts of children, who have were never really exposed to it for a couple of years during COVID. Daycares were shut down. We were masking. We were social distancing. We just didn't see RSV. We didn't see influenza either. And there was a couple of years when there wasn't really many cases of influenza, period. And the reason was we were taking a lot of extra precautions to help prevent transmission of COVID, but it had this effect of preventing the transmission of these viruses as well. So now all of those kids are a little bit older, and we're all kind of out and about again in the world, and we're seeing those viruses kind of come back up.
Dr. Smith goes on to explain which group of people may be more susceptible to certain illnesses.
There's a couple of differences in who's at risk for more severe infections with the three viruses. COVID and influenza can cause severe illness in children, and certainly have in the past and certainly do, but they tend to affect folks who are immunocompromised more. And then also they tend to affect elderly folks a little bit more too. But influenza certainly can cause a really awful, yucky illness in young infants and children as well. Whereas RSV, on the other hand, tends to cause the most severe illness in children who are less than 5, and really in children who are less than 2. So there's a bit different pattern of who is the most at risk between the viruses as well.
Dr. Smith and other local providers saw a spike of these illnesses in October, but currently see a downward trend of these infections in the area. While certain parts of our state are seeing pediatric beds fill up due to RSV and influenza infections in children, Dr. Smith wants to reassure the community that this isn't the case here, specifically in Marquette County.
Across the state, across the country, larger academic centers, pediatric academic centers, for example, are quite busy. Their beds are full of sick kiddos with RSV. Here in Marquette, I do want to reassure the community that we do have pediatric bed space available, and we're in good shape. Have plenty of resources to take care of the vast majority of sick kids who have respiratory illnesses like this.
Dr. Smith says the best way to prevent illness is to wash your hands, wear a mask, social distance, and stay up to date on your flu and COVID vaccines. In the studio, Brianna McLean, Local 3 News.